and welcome to eCAN Bites. My name is Elisa Piñón, and I'm a communications officer for the eCAN Join Action and your host for today's episode. This is the third episode of our podcast, eCAN Bites, and we have previously talked about the pilot's benefits and difficulties, and we've also asked the professionals involved in the project about the feedback they got from the patients that joined the study. Today, we'd like to dive a little bit into the application these pilots could have into national healthcare ecosystems. In other words, how could the eCAN experience be applied to the European healthcare systems in the light of the integration of digital care? To answer this question, we've invited 4 healthcare professionals that have conducted this study. We have the pleasure to talk to Erika Korobeinikova from Lithuania, Sofia Adão Fonseca and Magda Oliveira from Portugal, and Nektaria Chrysanthou from Cyprus. Thank you for being with us today. I would like to start by introducing you, Erika. First of all, hello and welcome.
Hello.
You are radiation oncologist at the Hospital of Lithuanian University of Health Sciences. As a person that has been involved in this project, how do you think this study could impact your daily practice in the hospital?
I think it's our first experience with telerehabilitation, as we were involved on the telerehabilitation part of the project. So it showed us that it's really possible, and it's really a good way to involve those to reduce the workflow in the clinics and involve patients who maybe live more far from the hospital and cannot come to rehabilitation. And even for those for whom this physical rehabilitation is not compensated, this one online suggestions for the patient really work good, so maybe they can help themselves just by we can give them advice, and that's how it might work, and that's a huge benefit for the patient of this project, and I think that's how eCAN can change the future, how we work with the patients after head and neck surgery, and maybe it can also evolve to other cancers as well.
Yeah, showing that telemedicine practices are actually a possibility and seeing the potential benefit for cancer patients in general is definitely a great first step. Thanks, Erika. Let's get more inputs. Sofia, you are a physiotherapist at the Portuguese Institute of Oncology, and your work is very physical and manual. Do you think telemedicine, as we tested, could work in cancer patients in Portugal, or would there be unfeasible issues?
I think the main difficulty is the time for the frequency of teleconsultation. We have really tight schedules with a lot of work, and so sometimes we can't do so many teleconsultations so frequently. But I think as we are a center that we have patients from far away from geographically far, I think it's a really nice option to follow and to make some follow-up of the patients that lives far from Porto. So I think it's a good strategy, not so easy to apply because of the time-consuming aspect.
That's a very good point. We need to make it feasible, but also efficient. We also have here Nektaria. You are a research fellow at the Bank of Cyprus Oncology Center, and you participated in Pilot 1A with breast cancer patients. From your experience, what's the most important aspect to consider when it comes to implementing telemedicine tools in European healthcare systems?
And basically, we need to consider implementing this kind of technology we have in everyday clinical practice. And of course, in order to be able to do that, we have to train healthcare professionals as to how to talk to their patients through telemedicine and explain the benefit and how it can save time from both them and the patient in the future. Yeah, that's it.
Thank you for highlighting the importance of the training programs, Nektaria. In fact, at eCAN, we have worked on a free training program you can access to improve your digital skills as a healthcare professional. It's free, and for all our listeners that are interested, you can find it on our website, ecanya.eu. And well, let's continue with our round of interviews. Last but not least, I'd like to talk to Magda, clinical psychologist at the Portuguese Institute of Oncology in Porto. Magda, from your perspective, how could something like eCAN be implemented in the Portuguese healthcare ecosystem?
In a macro view, I think it's very important because with the pandemics, I think we became more awareness for the e-health and telemedicine issues. And I believe that when we work with patients that are very debilitated patients, it's obviously a good tool and a good strategy. In a micro perspective, I believe that the work that we have been doing in this project, and mostly with the contribution of Dr. Otilia, I believe that in the medicine department there are an increasing awareness about the importance of bringing telemedicine to our institution and to thinking a broader approach to the quality of the healthcare provided to our patients and families.
So it is also a matter of awareness within healthcare institutions, right? We need to make sure that the benefits of telemedicine are known by those that can actually integrate it in the healthcare system. Thank you so much for sharing your experience with us today, Magda, and also the rest of you. We will leave it here, and there is only one more episode to go, but we encourage you to stay tuned and take a look at our previous episodes as well. You will find more information about our pilots and how they contribute to strengthen the e-health ecosystem in the European Union. See you soon!